the information on the following slide is not intended to be used as a substitute for diagnosis or treatment from a qualified medical professional. This is to be used for educational purposes only. We do not claim to mitigate, treat, or cure any condition. So for medical advice, please see a qualified medical practitioner. So what is PANDAS and PANS? PANDAS is a condition where someone gets a strep infection like strep throat or impetigo, and it triggers a misdirected immune response where the immune system starts attacking part of the brain called the basal ganglia, which leads to the sudden onset of neurological and psychiatric symptoms. PANS is the same thing, but it does have other triggers, and it can include both infectious and non-infectious ones. The infectious triggers often include Lyme disease, influenza, mycoplasma, and more. So the PANS diagnostic guidelines. PANS is a clinical diagnosis, meaning that there's no specific test for it, but testing can be used to find out the infection that may have triggered it. So the guidelines: the individual has obsessive compulsive disorder and or an eating disorder with a severe and acute onset, with at least 2 out of 7 other specified concurrent symptoms, which can include anxiety, especially separation anxiety, emotional ability, which can include mood swings and depression, irritability, aggression, and oppositional behaviours, which can include rage attacks, behavioural and developmental aggression, such as baby talk and acting younger, deterioration in school performance, especially related to maths, handwriting, ADHD-like symptoms, and memory issues, sensory and motor changes, such as tics and sensory processing issues, psychosis, and somatic signs, such as increase in urinary frequency and sleep disturbance. What are some of the main things to look out for? A sudden change. PANDAS PANS isn't always sudden. A lot of the cases are. And some people change and become completely dysfunctional and tormented overnight. Many parents say that they've lost their child. Severe obsessive compulsive disorder that doesn't respond well to the traditional OCD treatments, or a sudden eating disorder, especially one related to OCD fears, and symptoms that change over time with infections and have a relapsing and remitting course with new symptoms developing in each flare, or people having a mix of symptoms that can't be put down to any other known condition. So what can it be like? A child who is usually happy and carefree suddenly becomes depressed and hates themselves for no reason. A child who is usually very kind and loving suddenly becomes defiant, aggressive, and has a major personality change. A teenager who is usually getting top grades in class suddenly struggles to write, do basic maths, and memorize things, and these cases would all be accompanied by OCD and eating disorder or tics. PANDAS PANS itself is not life-threatening, but the complications of the eating disorder and severe mental health struggles may have life-threatening consequences, and a small percentage of people with PANDAS PANS have seizures, and for some people, the seizures can pose a threat to life. PANDAS and PANS can actually affect adults. Although the P in PANS does stand for pediatric, the National Institute of Mental Health lifted the age restriction, and people with PANDAS PANS can have a flare if exposed to a trigger or an infection in adulthood, and people with untreated PANDAS PANS can have symptoms which persist into adulthood. PANDAS PANS is very misunderstood, but thankfully this is changing as awareness is increasing. Some people do say that they don't believe in PANDAS, however, it is recognised by the World Health Organization and is in the International Classification of Diseases 10 and 11. The misunderstanding means that people are not given the support that they so desperately need, so people may be left severely disabled without the correct diagnosis, and this really needs to change. Is it being researched? PANDAS PANS have been researched by Stanford University, Harvard University, and Yale University. Stanford University have their own immune behavioural health clinic where they actually specialise in treating PANS. What are the treatment options for PANDAS and PANS? The first one is antibiotics, which can get rid of the triggering infection. And people with PANDAS PANS can actually respond very quickly within 24 to 48 hours, and it can decrease the neurological and psychiatric symptoms. And some people are also on long-term antibiotics, as this can prevent someone from getting another infection, which could trigger a flare, which is when the symptoms suddenly get worse. So anti-inflammatories are also used, and this can reduce the brain inflammation and reduce the symptoms whilst somebody's in a flare. And some people, it's also said to reduce the duration of the flare. Some people are also prescribed steroids, but these may not be for everyone, and some people prefer to use natural anti-inflammatories. IVIG is intravenous immunoglobulin, and it's where people get an infusion of antibodies which are pulled from thousands of donors. There are side effects, but of course that's the same as any sort of treatment, and it's used in moderate to severe to life-threatening cases of PANDAS PANS. It's very helpful and effective for most people, but there is a 10 to 15% fail rate. It can be very expensive if not covered by insurance in the United States, but for many people it's worth it. Diet and supplements. So some people with PANDAS PANS have food sensitivities which can trigger symptoms, and these sensitivities are usually delayed, so they aren't picked up by traditional allergy tests as they have different antibodies involved. People can be sensitive to lots of different foods, such as dairy, gluten, food dye sweeteners, corn, citrus fruits, nightshade vegetables, sugar, and more, but it is different for everyone. And some people find it useful to remove inflammatory foods from the diet, such as gluten, dairy, sugar, and additives, because this can help someone see an improvement. And some people take supplements such as vitamin D, which is recommended by the PANDAS Physician Network. But of course, the dietary changes can be very difficult for someone with the eating disorder aspect of PANDAS PANS. It is a waking nightmare. People are often severely disabled by it and can require full-time care, and parents can leave employment, and it can be traumatic to the family. So people might struggle to do things they once loved and may be unable to do daily tasks, and parents often mourn for the child they have lost, as it really hurts to see that their child has completely changed. So a lot of people wonder what's the difference between PANDAS PANS and Tourette's and OCD, because it can look very similar. 70% of people with PANDAS PANS are said to have tics, and these tics can look very identical to Tourette's, like very similar and sometimes identical. So it is important to find the distinction. So I would say the main differences are that the onset of classic OCD is usually gradual, with subclinical symptoms that gradually get worse, but PANDAS PANS is sometimes overnight. People can have no symptoms and then suddenly wake up with very, very severe OCD and many other symptoms. And it often PANDAS PANS often has a correlation with infection. The OCD in PANDAS PANS doesn't usually respond to traditional OCD treatments either. PANDAS PANS also has symptoms that aren't associated with classic Tourette's, such as dilated pupils. That's quite a big thing. Psychosis, personality changes, sudden oppositional defiance, loss of coordination, developmental aggression, REM behavior disorder, seizures, and an increase in urinary frequency. And as I said, tics is just one of the many symptoms of PANDAS PANS. But the reason it looks so similar is because the same part of the brain is involved, but the treatments and management strategies are different. People with PANDAS PANS can abruptly develop new symptoms when they go into a flare. So people can, maybe when they were younger, they had tics, OCD, and rages. Then they're fine for a few years, and then suddenly they become completely dysfunctional, can't think straight, have psychosis, mood swings, sleep disturbances, loss of coordination, and more. So it is very abrupt, very episodic. And people with PANDAS PANS do often see an improvement with antimicrobial and immunological treatments, but people with classic Tourette syndrome and OCD typically don't see that sort of improvement with that sort of treatment.